He called my name and I didn't respond. And he called my name again. I still didn't respond. And he rolled me over and I was blue.
It's terrifying.
Horrible. He has his own trauma from this event and I have mine. He did exactly what you're supposed to do in that scenario, which was to call 911, and then he initiated CPR. And that was very clearly the first step in saving my life.
So welcome, everybody. So today's guest, Stephanie Austin, has experienced something that very few women do. At the young age of only 35, she suffered a cardiac arrest while she was sleeping. Now, beside her, her husband, a doctor, fortunately enough, was able to administer CPR and try to sustain her until the paramedics arrived, which they did. But unfortunately, ultimately, they could not regain a pulse. So she was essentially gone. Now, obviously, she did get revived, and she's with us here today, thank goodness. But the impact of that event was profound. She not only lost memories of years prior and years since. She has a defibrillator that she lives with every day now in her chest. But most importantly, that event sparked a passion in her to share her story, both as a warning and a call to action, because it doesn't matter how, quote unquote, young you are, man, woman, this could happen to anybody. And she's here to help us prepare. So first off, thank you for being here, and thank you for being here. Welcome to the show.
Thank you so much. I'm so happy to be here, especially during Heart Month.
It is
perfect
Heart
timing.
Right.
Month. And I am so excited to have you here because we spoke previously.
Yes.
But I know Mark went through it a little bit, but I would love to hear your story of the morning of the cardiac arrest.
You know, to somewhat set the stage, I was 35 years old. I have two children. At the time, they were 4 and 7, two boys. And like a lot of young moms, juggling a million things. So I was PTA president and running the house and mother of the boys, but I was also really active. I'm an athlete. I was a total jock growing up. So at this point in my life, I was on 3 soccer teams. I played co-ed soccer. I played co-ed ultimate frisbee. I lifted weights. I had just started playing tennis because I knew soccer wouldn't be sustainable for the rest of my life. Right. And so it's important to note that when this event happened, I was very healthy, because I do think that that is part of the reason I came out of it as well as I did, because I had a good base to survive. Fortunately for me, my husband got a phone call at 6 a.m. on Sunday morning from a resident. It was because he did that he was awake to hear me take what would have been my final breath. I exhibited agonal breathing, which kind of sounds like a snore or a snort. It is absolutely not a normal sound. He called my name and I didn't respond. And he called my name again. I still didn't respond. And he rolled me over and I was blue.
It's terrifying.
Horrible. He has his own trauma from this event and I have mine. He did exactly what you're supposed to do in that scenario, which was to call 911, and then he initiated CPR. And that was very clearly the first step in saving my life. He performed CPR until he heard the sirens coming, at which point he said to my then 4-year-old who was in the room, "Go get your brother and open the door for the police." And being a 4-year-old boy, he continued dancing in the corner of the room and had no idea, thank God for the obliviousness of youth. And so my husband had to stop doing CPR, run down 3 flights of steps, let them in, run back up. So all that time I went unsupported with no oxygenated blood circulating to keep my organs alive and healthy. The medics came in, they shocked me unsuccessfully. I didn't come back initially. I know when I was being put into the ambulance, I still had no pulse, because the neighbors have told me that they remember Matt giving the children to them so that he could come to the hospital. He turned and yelled at the medics, "Pulse," and they yelled back, "No pulse." And they said they'd never seen somebody turn that color of gray. I ended up being airlifted to a different hospital, which was better prepared to manage me, because I was at a small community hospital at the beach, and I got airlifted to Philadelphia, at which point they started a hypothermic therapy to preserve brain function, where they cool the body. But that's generally should be done, I believe it's within 3 hours, and this was about 12, 13 hours later. So I woke up the next day slurring and stuttering. I didn't know my husband. I didn't know my children.
You didn't know your husband or your kids?
For many days, many days.
Wow.
I told everyone I was bit by a shark because I had a scratch on my arm, and that's what I thought. They were doing echocardiograms, which are ultrasounds of your heart, and I told everyone I was pregnant. I mean, I was not completely there. And I think in hindsight, from what I'm told, it brought a little bit of levity to an otherwise incredibly stressful situation. My husband told my friends, just go with it. I spent 2 weeks in the hospital. I got a defibrillator and pacemaker placed in my chest. We know I have cardiomyopathy, but I also have a deadly arrhythmia, which we did not realize at the time. And then I began what I refer to as my new reality, my new life. I was in recovery for about 9 months, where I slept 12 to 18 hours a day because I was in heart failure. It was like treading water. All I could do was keep myself afloat. I could not be the wife I was accustomed to being. I couldn't be the mother I was accustomed to being, the friend. I couldn't manage the house. I could only manage me. So as you can imagine, that is a big change for not only me, but for everyone that interacted with me.
Especially somebody who was so athletic and active.
Yes.
How long were you without a pulse?
Oh,
On your
several
own.
minutes.
Several minutes on your own. But
Yes.
when you were being airlifted, you still weren't on your own. You were being
I was being
sustained by-
supported.
Got it.
Yes. I did have a pulse at that point, but I was in essentially like a coma.
Got it.
So yes, they were letting my body recover.
Boy, that's a lot to go through.
Yeah.
I think we all know about CPR, but maybe I'm just being dense. What exactly does the CPR do?
Oh no, it's a
Yeah.
fantastic question.
Thank you.
And I spoke to it last night when I was teaching people CPR. The blood in your body is oxygenated. It is carrying oxygen. So even if you are only to do compressions, which is something that the American Heart Association is recommending now because it is much easier. There's really only 2 steps to hands-only CPR. They are call 911, press hard and fast in the center of the chest. That's it. That alone increases survival 2 to 3 times. Yes, exactly. It's pretty
Right on
much
the
right
sternum,
along
right?
the nipple
Right
line
above
on
the
the
sternum,
sternum.
right.
Yes.
Nipple line on the sternum.
Why did
Okay.
they
Yes.
move away from administer breaths, go back to CPR, or
Right.
go back to compressions, administer breath? But that when we were growing up, that's what we learned.
You should not take more than 10 seconds to do the breaths. I'm also a certified instructor in CPR and AED and first aid. It's just another complicated step. And oftentimes people are hesitant to put their mouth on someone else's mouth. And especially since COVID, you can understand why that has become a greater issue. Now, knowing that the blood carries the oxygen, by doing the compressions, the CPR in the center of the chest, what you are doing is squeezing the heart between the ribs and the spine, and that is pushing out that oxygenated blood. And what that is doing is keeping the organs alive so that you can be maintained until professional help arrives, which is why 911 is the first step.
Yeah. But is that also flushing out? When you compress, are you also compressing the lungs? And by nature of the vacuum, nature of the pushing, you're refilling their lungs with oxygenated blood? Because how long could that go on if they're not breathing?
That can go on indefinitely. You do that until help arrives.
Sure.
Breathing is really most critical with children, infants, drownings. It is still very much recommended in those instances.
I didn't realize that.
Yes.
So
but
it's still...
See, we're learning things
that's
already.
Great.
yes.
So an adult, you could just do compressions. A kid, you
100%.
should breathe for them as well.
Yeah, 100%.
Wow.
100%.
I didn't
And
know
the
that.
compressions are, you're doing it to the beat of staying alive,
Yeah.
staying alive. But there's really, you can go online. There are a million songs that you can look up. Like the Rocky theme,
know
our home
So
Philly
it's-
song.
Really?
That's the same. Staying alive.
So you want to,
staying
but you don't
alive.
go staying alive.
No. You do have to have some musical background, I think.
I don't.
Hilarious.
I mean, I'd be in there like,
Hopefully
you
you
know.
can carry a tune.
Yes, it is technically 100 to 120 beats per
Okay.
minute. But if you Google CPR songs.
That's funny. I'm
You
gonna
can
Google
you
that.
can
Yeah.
find
I
a
had no
whole
idea.
list.
I only ever heard Stay
And I think
Alive,
it's
but the
good.
Rocky theme is funny.
I think
Yes.
it's also good to like have some fun with this, so that people aren't
You
like, this
think?
is
Like
so
in the moment?
great. Not in the moment, but I think
Write your
when
own
people
song in the
are
moment.
people are learning, right? Like,
Yes.
don't
Yeah.
you think things will sink in faster if you can have a little bit of fun?
There's a huge part of this that is feeling confident that you can
Right.
do
Yes.
something. And one of the biggest points I like to make to people is if someone needs CPR, they're dying. You cannot make someone more dead. You know, people worry about, well, what if I don't do it right? What if I break a rib?
Break a rib.
Okay, bring it on.
Yeah.
Break a rib.
Break my ribs.
Yes, because first of all, then you are most likely doing high quality CPR. You would rather press too hard than too soft because you need to go in an adult 2 inches down. I will tell you, it's work. It is.
It should be hard. is
It
what
should be hard.
It should be hard.
It should be hard. It is not an easy thing to do. The bigger the person, the more difficult it will be to do. You can order online. There are inflatable mannequins. I bring it out at the holidays for people to practice, and it creates a muscle memory just by doing it. It's probably $25 or $30. It's not very expensive. It's certainly no big investment considering the payoff you get. The return on that investment is being empowered to save a life. And more often than not, if you are called upon to do bystander CPR, overwhelmingly more often than not, it will be on someone that you know. And I can think of nothing worse than watching someone you know
Yeah.
suffer
Sure.
and thinking, if I only knew
Right.
what to do.
God
Right.
forbid.
And really what it is, and I also want to know, when you call 911, you can put it on speaker.
Right.
They will talk you through it.
Right.
And then the medics will come and they will take over.
I just recently heard now I'm like working with the American Heart Association, which is great right now. If a man falls in the street, there's an 80% more chance that he will get CPR than if a woman falls in the street.
Yes.
Now, I've heard it could be because
Oh,
of
it's because of the
boobs.
tatas.
It's because of the tatas.
Yes, it is. I'm so glad you brought up this point because it is worth
It's an
noting.
interesting stat.
People, it is, but it's terrifying and it's unfortunate on so many levels. People worry about being sued, and you need to know there is a Good Samaritan law in effect in every state. As long as you are acting in good faith, you cannot be sued. You know, you are trying to save a life, you know, and that is the point. But people do get hesitant. You go right in between there. It is one hand over the other, and
Try
you
it,
want
Mark.
to lock your elbows because otherwise you're using your arms. You want to use your
wanna use
back.
your- yeah.
Lock your
You want to
elbows.
use your back. You lock your elbows. You're putting this on the sternum, and you're pushing down, and you're using your back to
using
push
your
down.
weight to push down.
100%.
If I saw a 35-year-old woman fall down the street, the last thing I wouldn't, not that I wouldn't think of it, but I would go through 70 scenarios before she's having a heart attack.
Why? Because you don't know that it's the number one killer
It's a
of women?
35-year-old woman. Like, what?
Yeah.
That's not the first thing that comes to
Yeah.
my mind. I see a guy keel over. I'm like, maybe he's having a heart attack.
Well, and that's
So how do you determine? Like, what?
if someone needs CPR,
Yeah, exactly.
what you
I thought you were
do,
saying that.
you go up to,
What? What'd you say?
they're on the ground, you're taking their shoulders, you're shaking them. Are you okay? Are you okay? If they do not respond, and you can look and see if their chest is rising, you can put your hand over their mouth,
Sure.
the nose to see if you feel anything. I will tell you, it is always better to do it than to not do it. If they can speak, well, presumably they'll say, get the heck off of me. But if they can speak, they do not need CPR. But if they cannot speak, then you will call 911 and initiate CPR as long as you're in a safe environment.
Can you
know.
cause problems if they're not having a heart attack?
No, you
Like if
cannot.
they just pass out or they have a stroke, God forbid, something that has nothing to do with their heart, and you say, "Oh my gosh, let me perform CPR."
Yeah, you'd rather
can't-
do it than not do it. 100%. The other thing you can do, and I will tell you, I believe it's called a sternal rub. You take your
yeah.
2
I've heard of that.
fingers, your knuckles, and you rub right in the middle of the chest. It hurts.
That does hurt.
Yeah,
we
it-
call it schmelly. I do that with my kids. We call them
Schmelly.
schmellies. We do.
Schmelly.
We go,
I mean,
that?
even if you don't like put a lot of effort into
Yeah,
it,
'cause it's the
even
bone.
then it hurts.
Yeah.
Exactly. So you do that pretty hard. If they don't react, you're
Okay,
doing CPR.
that's great. I didn't know
ah,
that.
that's such good
So that's it.
information.
That's
Right?
it.
Do that and if there's no reaction, go right to 911.
And then
CPR.
initiate
911
CPR.
and then CPR, but you're asking them first, right?
Smelly.
So let's
Yeah,
say that
are
one
you
more time.
okay? Are you okay?
Are you
You're
okay?
shaking them by the shoulders. Are you okay? Are you okay? You can do the sternal rub. You can check for breathing. But if you're not getting anything from any of this, then you are calling 911, putting it on speaker. They can talk you through things, and you're initiating CPR. And I also want to differentiate just for your audience, for you guys. So what I had was a cardiac arrest. And you were referencing a heart attack.
Heart attack.
Now, a heart attack can lead to a cardiac arrest, but they are not the same thing.
What's the
Because
difference?
a heart attack is a plumbing problem. That is like a blockage in the artery. More frequently than not, that is the cause for cardiac arrests. But my cardiac arrest, for example, was caused by an arrhythmia. A cardiac arrest is an electrical problem.
Got it.
So a heart attack is a plumbing, cardiac arrest is electrical. Heart attack, you can be having a heart attack and talking to somebody.
Right.
Cardiac arrest is 100% fatal without intervention.
Are there precursors? In other words, if I'm having a heart attack, a lot of times your arm goes numb.
Correct.
Is there anything like that for cardiac arrest, or is it just
It's pretty darn
electrical?
quick.
It's on or off?
Yeah, it's pretty darn quick. And a cardiac arrest is what happened to Damar Hamlin.
Okay.
So people kind of saw him get up
Yeah,
and
that
then
makes
just
sense,
kind
right?
of
It wouldn't have
fell
been- right.
down. And it is that immediate. It is that sudden.
In a cardiac arrest, does your heart stop?
Yeah, it either stops or it is beating so fast that it doesn't have the heart has to compress and push the blood out. If it's going like this, there's no time for the heart to fill. So that would be like a fibrillation, and then that leads to the cardiac arrest. And then there is no electrical activity.
Okay, so there's so much. I have so many questions right now, but you mentioned the symptoms that you think are for a heart attack, right? Men and women have two different types of symptoms
Yes.
for a heart attack. Heart disease is the number one killer of women. Am I right?
It is both the number one killer of women and the number one killer of people. And I will tell you, with women, it kills more women than all cancers combined. So women do not know that.
know that.
No one knows this.
Because you can't tell. Like my husband and I created a campaign called The Faces of Heart to highlight that these are the faces of heart disease, because now with every passing year, I may look more and more like I have heart disease, but at
No.
35, I certainly did not. There are more women than you would think that are in that scenario. It's not the old overweight white man's disease anymore. Those images linger for people. And so people are less likely not only to react to someone else having symptoms or problems, but also to recognize them in oneself and to then be able to and feel confident advocating for oneself.
Right.
Because I know many women who were in the throes of having either a stroke or a heart attack that didn't act because they didn't think that could happen to them.
Right.
Especially with stroke, every second counts, but it does as well with a heart attack. So, because you lose heart muscle.
I'm assuming cardiac arrest can happen to anybody at any time. Was yours congenital?
We do have a family history, which I did not know about
Okay.
at the time.
Got it.
But my grandmother's sister died suddenly in her 30s. Back then, the research wasn't where it is today. So my mother was a child, and she was told that she died of a broken heart. I found out in a really odd way years later. I was out in Pittsburgh, so very far from here, from Philly, and I was getting a massage at a spa. And I walked into a room, and the woman said to me, "I see auras and colors, and I can tell you have a guardian angel." And this is maybe a year and a half after my cardiac arrest. And I thought, well, listen, I survived something that kills 90% of
Maybe you
people.
do.
Who knows?
I could get behind this idea. We do the massage. I don't say anything about my history, nothing. We get done the massage. She says to me, hand to God, she says to me, "Never in my life have I heard voices. During your massage, all I could hear were the names Margaret, Grace, Margaret and Grace, Margaret and Grace. They want you to know that they are here with you. I think they're your guardian angels." And she says, "Do those names mean anything to you?" I said, "Well, Margaret was my grandmom's name. I have no idea who Grace is." And she said, "Well, now that I've told you, they've stopped. And I think they're your angels." I said, "Okay." So I called my brother to tell him the story. And a couple hours later, my mother called me and said, "Oh my gosh, Grace was your nanny's sister. She died suddenly in her 30s when I was a baby. All they ever told me was she died of a broken
That's
heart."
wild.
Chills.
Yeah.
Crazy.
So I will tell you, anytime
that.
anything happens and, you have a near accident or even if I find something I haven't been able to find for a while, I'm like, thanks, Nanny. Thanks, Aunt Grace, because I think they're with
love
me.
that story's incredible. I
so-
really want to go back to the symptoms and the difference between the symptoms
Yes.
in men and women.
Yes.
Yeah.
Because I want someone to see this or listen to this and say, I know this is a heart attack.
Yeah.
I know when I watch a movie, I know a heart attack. I see it's normally a man, and they grab their chest and they fall to the
grabbed
ground.
the chest,
Oh, he's
they
having
grabbed
a heart
his arm.
attack, right?
Superman's dad grabbed his arm.
I
and
do.
fell
Yes.
over.
I do know
Yes.
that.
Right.
And then women, I think there's jaw pain, arm pain. I've never known a woman to call 911 because she's having jaw pain because most women
Had no idea.
would be like,
Yeah.
I'm good, I'm fine, everything's
My
great.
jaw hurts.
Nausea, back pain, jaw pain.
How do we tell
and,
them?
and the chest thing still happens for women too.
Okay.
But I think one of the biggest takeaways for me, if I was talking to women about this, is trust your body. Like, you know your body better than anyone else. You would rather act and find out that there's nothing wrong than not act. If you feel like something is wrong, you need to call 911 and get to a hospital. And knowing your family history, knowing your numbers, by that blood pressure, cholesterol, BMI, if you have diabetes, these are all risk factors. Women, if you've had preeclampsia when you were pregnant, that puts you at a higher risk for heart disease later at life and at an earlier age. And whereas I am an outlier, to your point, heart disease in women is affecting more women at a younger age than ever before. Women were traditionally left out of the research. So the Go Red for Women movement, for which you are an ambassador now, Stacey, with the American Heart Association, yay, and thank you. They push for a lot more funding for women to be included because there is a correlation between hormones. There are different symptoms for women versus men, and we won't know them until we research them. But it is definitely more prevalent in women than it's ever been before, and in younger women.
What should we do
Wow.
if we don't have a brother and a husband who's a doctor to get
Right.
the care and advocacy that
You
we
need to advocate for oneself. You really do need to advocate for yourself and for your family members. And if you're not being heard, you make yourself heard. If you don't think your doctor is listening to you and you know something is wrong, like I know women who were told they were to go see a psychiatrist, that it was anxiety and panic attack. And what it was she had a blockage in her heart. She ended up needing to be treated for that surgically. It is a real problem for women.
You had cardiac arrest.
Yes.
You were taken to the hospital. You had no pulse even being put into the ambulance.
Correct.
And they didn't address it for 13 hours in the emergency room?
I didn't see a critical care doctor for 13 hours. People look at us, they don't think that's what it is.
So, got it.
And-
That's why it wasn't addressed properly.
Yeah, yes, absolutely. Healthcare is not the same everywhere.
Sure,
And
sure.
a lot of what, I'm a volunteer and an advocate for the American Heart Association. And a lot of what we do is trying to create standardized guidelines in all hospitals so that there is not that discrepancy of care within hospital systems.
I just want to drive the point home.
Yes.
For any woman listening or watching, or man, because my sister is in her early 50s. She had two friends recently who had indigestion. They were both having heart attacks.
No way.
Yes.
Somehow got themselves to the hospital and are fine. But is there a way that we can tell people, okay, when your indigestion is at an 11, or when your jaw pain radiates this way, or like any kind
Yeah,
of
one of the
indicators or markers that we can give people?
I really do think it is an overall feeling of trust yourself, trust your gut. We have instincts for a reason. We get these senses. A lot of the women I know who have stories like your sister's friends, we let our mind take over. Like, well, let me just get the kids off to school.
Sure.
Let me just clean this and then I'll do it. And I have a friend who had also at 35, one of her coronary arteries dissected. and she, had arm weakness and she felt weak and she just didn't feel right. And her husband wanted to call 911 and she just wanted to get her kids off to school before they did it. And ultimately, she allowed him to call 911. She walked onto the ambulance and then she went into cardiac arrest and was shocked so many times that she has burn marks on her chest. Wow. She was given last rites at the hospital.
Wow.
You would meet her today. You would never look at her and know. But she had a sudden coronary artery dissection. It's called a SCAD event. But she wasn't listening to her. She wasn't trusting herself because she was thinking like a mom. Well, let me just do this. And that's part of the problem with women too, and why we aren't managed in the same way, because we are so busy juggling our lives and our families and managing everybody else. We don't put ourselves first. You have to put on your mask first and then assist those that are with you. If we do not take care of our own bodies, if we don't listen to them and advocate for ourselves and keep ourselves healthy, we are not going to be here to help anybody else. So it's really important. It is not a selfish thing. It is a self-maintenance thing, and it needs to be done. And we need to do a better job.
Are there tests we should have beforehand to know if there's anything going on with our hearts that we're maybe not doing at a regular physician's appointment?
I think it's very important to communicate with your physician about your family. Knowing your family history is clutch. Making sure you're getting your cholesterol checked and your blood pressure, because there is a reason that blood pressure is called the silent killer, because there are no symptoms of high blood pressure, but it is a huge risk factor for stroke and heart attacks. So that is another thing. There is also something called a calcium score that you can talk to your doctor about. It is a very easy, non-invasive test, and I believe it is most often used if you are borderline for being treated for high cholesterol. This can be something that would push you over the edge one way or the other. Like you don't need meds or you do need meds. But, these meds for cholesterol and blood pressure are very effective and very safe and very widely used. And so there's no reason to be afraid of it. Knowledge is power. A lot of people just like to ignore their symptoms, or they are afraid of the doctor. They don't want to go. But knowledge is power, and we can protect ourselves when we know. And so it's know better, do better.
Going to the doctor is very inconvenient.
It is.
The pain will go away.
Do you go to the doctor? Do you get checkups?
I mean, yearly? No.
Yeah.
No.
Okay, yeah. No, this is a problem. You need to
I
go.
speak for the rest of America who
do you
does
have
not
any-
go to their doctor on a regular basis.
Is your cholesterol good? Is your heart
I'm good.
blood pressure good? That's great.
I'm good.
There's a lot of
Have
people-
have they been checked?
Um,
Or are you saying they're good because
I feel
as far
great.
as you know? But that's the point. This is the point. This is
Mark,
the problem, America.
You're the problem.
well, I went to a cardiologist because my father had heart issues, and he said, "You're fine."
Good. When
many-
was
how many
that?
It
years
was a
ago?
while. It was a little while ago.
Yeah. Okay. So things change, Mark.
But
It's
anyway,
important.
back to you.
but for women too, because I think after
Yeah.
menopause, doesn't it like
Yes.
skyrocket?
Yes, estrogen is a very is cardioprotective. So once you hit menopause, your risk factors generally go up. Now, again, this is not going to be across the board for everybody, but there's a reason heart disease is the number one killer in
Yeah,
America.
sure,
so
sure.
it does generally affect
You just hit
everybody.
yourself.
Get in the
You're trying to
doctor.
hit me, and you hit yourself.
Everybody
Yes.
needs to go
I
to the
enjoyed
doctor.
that. Can I ask you, listen, back to your
Please.
story. So, what is the physiological reason why you lost your memory and have trouble
Oh, so
remembering?
my brain went without oxygen for a while.
It was that fundamental. Got
Yes,
it.
I mean my
And that was the
pupils
reason
were
affected.
dilated when I was blue, and so I went without oxygen for some time before CPR was initiated. But then remember, Matt had to leave me, go
Right.
down, let everybody in. They had to come up the stairs again. So all that time I was unsupported.
Got it.
So I have completely lost 3 years. The year it happened and the bookend years. The year before, the year it happened, and the year after. And my short-term memory is no bueno. It is not so good. And on the upside, I can read the same book multiple times, watch the same movie multiple times. You can give me the same gift over and over, and I will be very happy because there is a change in perspective that happens, I think, and at very least happened with me, I can speak to. There is a gratitude and an appreciation for life and a perspective of what really matters in life.
Yeah.
And if you really think about that and are honest with yourself, what really matters in life you can count on one hand. And that is where I'm going to put my energy. Emotionally, it was harder than physically, to be honest with you. And that's where I had to redefine my new normal and redefine how I valued myself. And what I wanted to do was to give back and to help others and help empower others, whether it be to save someone else's life with CPR or it is to advocate for themselves and save their own lives. And that's when I became a advocate and a volunteer with American Heart. And I've met so many amazing people, not only that are that work for the American Heart Association and survivors, but also community leaders that use their time and talent and resources to further that mission of helping others lead healthier lives. And so I have to say, as much as it's one of the worst things one could imagine experiencing, it's one of the best things that have ever happened to me, because I couldn't live the life I'm living now were it not for that.
Right.
And the way I'm living my life now is so much healthier than I was living my life before. And that's a gift. And so for that, I have to be grateful for the experience.
Sure, and all the people you're helping too on top of it.
It's wonderful
as well.
Yeah,
really
it's
is.
just amazing, and I totally resonate with that, because I know you know, and I think I spoke to you about the fact that I almost died a couple of years ago. And when I was in the hospital, I had a massive infection in my face that went septic. It was MRSA. They told me that they thought it was around my heart.
Yes.
And the reason why I'm an advocate for the American Heart Association now is because I was lucky, thinking about the fact that I might have had a changed and challenged quality of life, and that my heart would have been affected with endocarditis, which would have changed everything for me. And I can totally understand where you're coming from in terms of your perspective changes. Now, it varies, right? After the event, I was so like, what am I doing? Why am I, running at all speeds? And, as time goes by and I'm feeling good and everything's fine, then you kind of slide back.
You got back on the rat wheel, didn't you?
The rat wheel a little bit. And
Yes.
so this is why I'm here now, working with you and other people from the American Heart Association and Go Red for Women, because I want to give back, and I want maybe one person will watch this podcast or listen to this podcast, one woman or man or whoever, and will have something happen, and they'll have jaw pain and call 911 when they wouldn't have before.
Sure. It will happen, because I have done things like this before. I once did a radio program, and that's how I got connected with a woman. She found me on social media. We connected. I have since gone to her church, taught people CPR, helped them advocate for themselves. I mean, what you're doing is amazing. And I think we all need to use what resources and platforms we have to help others. I mean, there's a reason it takes a village, is a saying, and it really does take a village. My whole recovery journey took a village. I needed a whole heck of a lot of support, and I was lucky to have it. But also, you have to appreciate that is a journey, right? And to the point you were making, I would say it took me a good 7 or 8 years, I think, to get to where I am today after the event, because old habits die hard, and you get back on to what you think is normal. And then I had to, for me, some of the changes had to happen because I needed much more sleep post cardiac arrest than I ever did. I only slept about 5 hours a night prior to the cardiac arrest, and I thought I was fine. Like, you would have asked me, and I was like, I'm cool. Like, this is good. Well, I needed more after the cardiac arrest, and now I know my body needs more.
Right.
So now I am very cognizant of getting 7. To be fair, I would rather be getting 8, but I'm getting somewhere between 7 and 8 usually every night.
That's wonderful.
And I am, and it's hard to do that. It's hard to make lifestyle changes. No one likes change. It's annoying, but we need to, if we want to stick around here, we need to make some changes.
So I have one final question about your memory. So you said you lost a year prior.
Yeah.
So you lost, for instance, your son's 3 to 4 years old.
Yes.
Are there, and if you look back at pictures, does it trigger anything? Are there cloudy images or anything like that, or is it just gone?
Every once in a while, it's like a flash. So I will tell you, the year of the cardiac arrest, a month before was my 10th wedding anniversary. And Matt and I went to Hawaii and had this beautiful time. And now I don't remember really any of it. There is one picture in a waterfall that I vaguely remember there was another couple there.
Yeah.
But that's the end
That's
of the
it.
memory.
I wish we had like another hour to talk to you. There's
can
so
always
many
come back.
questions.
always come back.
Come back, and people can talk to you and ask you questions, right?
Anytime. So I'm on Instagram at @SAustinHeart. I am on Facebook, Stephanie Austin. Much of what I post is about heart health. So you can reach out to me that way. I work alongside the American Heart Association in Philadelphia. They always know where to find me. And I'm an open book. All I want to do is, make an impact and help other people lead healthier lives. So whatever I can do towards that end, happy to do.
Great.
You are an
You're doing
angel.
both.
I am so glad I met you.
Thank you.
And that you came in today. And I can't wait to get this episode out. We're going to rush it out during Heart Health Month. So
Love it. Love it. And I guarantee you it will be
at least
impactful.
one person.
It happens. It
Yeah.
will happen. And that's all it takes.
Yep.
You save one life,
That's it.
you're a champion,
Mission
my
accomplished.
friend. That's
Yeah,
right.
for sure.
Thank you so
Thank
much
you.
for having me.
You got it.
Thank
And thank
you.
you guys for watching.
Thank
we will
you.
see you soon.